All right, awesome. Looks like we got a couple more people that signed in. So thanks again for you guys for all being here. Uh, just wanted to introduce myself. I'm Dr. Sally with Regenexx Pittsburgh. Thanks for being here at the webinar tonight. I hope you enjoy it. So let's take a second here and we'll go ahead and get started. So I'm going to be talking to you. I'm going to be talking to you guys tonight about Regenexx, trusted alternative to orthopedic surgery. Thanks for being here, like I said, and let's get to it. So who am I? I'm Dr. Jess Sally. I'm with Regenexx Pittsburgh. I did my undergraduate training at Virginia Tech and the Virginia College of Osteopathic Medicine in Blacksburg, Virginia. I'm originally from Pittsburgh, but I did school down there for about 10 years. Came back to Pittsburgh and did residency and fellowship training at the University of Pittsburgh Medical Center in physical medicine and rehabilitation is my specialty, and my fellowship training is in sports medicine and spine medicine. I've been an affiliate of the Regenexx network since 2015. At our clinic, we have been practicing with Regenexx since 2012. Prior to that, I was the head of sports medicine at Washington Hospital and the team doctor for the Washington Wild Things. So let's talk a little bit about why you're here. Like I said, I appreciate you guys signing on tonight. Most people are attending this webinar because, well, you're not here just to hear me talk. You're here to maybe talk about some pain issues that you have and to get some options about avoiding surgery. Some of you may not be surgical candidates and you're looking for options in terms of what's available to you. Maybe you don't want to take time off of work, or you don't want to be down for surgeries that are going to take time for you to recover from. Maybe you don't want to rely on medications anymore for pain control. Maybe you're just not ready to slow down and you want more out of your life. So today's agenda, I'm going to talk to you a little bit about what Regenexx is. We're going to talk about some of the current options that you have for treatment, both within Regenexx and outside of Regenexx. I'll talk to you a little bit about what interventional orthopedics is. That may be a term that's thrown around as we sort of talk through things. We'll talk about how Regenexx is different from some other treatments that are out there, and we'll also talk about who these types of treatments are for and what kind of results you can expect. So the goal really is to help you to see some of the some of the alternatives that you have in terms of picking your care. I'm going to help you discover if you feel like you're a candidate for these types of treatments, which, spoiler alert, I can pretty much say that most of you probably are. And then we'll talk about how you can schedule to talk with one of us in the clinic and get all of your questions answered in addition. So let's talk about the care continuum that everybody sort of goes through when we're dealing with pain issues. So initially, you probably go either to your orthopedic specialist or maybe to your primary care physician, and you're offered a couple basic options. It's either going to be medication, maybe pharmaceutical, anti-inflammatories, pain medications, whatever it may be. Some places may offer you steroid injections or some other types of injections like hyaluronic acid, Regenexx, or Synvisc, Hyalgan, some of these other ones, the rooster shots that some of them refer to. And outside of that, maybe you'll get referred to some additional physical therapy, maybe a chiropractor, maybe some other alternative specialists that they may recommend, maybe some bracing, some other conservative care. Or the other option is if you fail most of that, then, the only other thing that they have on the table is surgery. So for people that don't want to go that far, Regenexx sort of has nestled their place in between some of that maximized conservative care and avoiding surgery or avoid advancing to surgery. And the evidence to really support surgery is scandalously poor, so to speak. There was a study done in the British Medical Journal in 2015 that actually showed that the evidence states that about 20% of procedures estimated to show that surgery is superior to non-operative alternatives. So only in about 20% of cases is surgery actually necessary compared to other things like medications or physical therapy or other treatment options. And actually 53% of the orthopedic surgeries in the United States were shown to be ineffective in clinical trials or not being better than a placebo-based sham treatment. So when you look at the surgery sort of overview for an entire year, you can see that there's a ton of surgeries that are performed throughout the course of the year. These are gigantic numbers in the hundreds of thousands. And a lot of these are big, risky surgeries, but most of them are covered by health insurance. But with that also comes about a 300% increase in risks of serious things that you don't want, like heart attacks, strokes, nerve damage, blood clots, death, all things that we look at and say, this is probably not a good option. So instead, what we're trying to do is stop the process of cutting things out, going away from scalpels and big cuts and incisions and stitches, and instead looking at injecting biologic agents or orthobiologics that can help with reducing pain and improving function. So what is the term interventional orthopedics? So most of you know orthopedics applies to surgery, but surgery of muscles, bones, tendons, all of the musculoskeletal system in the body. So basically, this is comparable to what they did with cardiology, where they used to do big open incisions in the chest. They would, pull the ribs apart, and it was a big open procedure. Now they're doing heart surgeries through little cameras that they snake up through the veins and do things under X-ray. So basically, what we're doing is we're taking orthopedic procedures and going from knife to needle. So we're exchanging the scalpel and the big incisions, and we're doing most of these treatments, all of these treatments, in fact, with needle-based injections under precise guidance. These procedures use your own cells from your body to help reduce pain and improve function. Like I said, you're using your own platelets and your own bone marrow concentrate, and we'll talk a little bit about what that entails later. We've actually shown that we can reduce the need for about 70% of the elective surgical orthopedic procedures that you may hear about otherwise. So where does Regenexx fit into all of this? So like I said, interventional orthopedics is more of a global terminology. So they're talking about a less invasive sort of new medical specialty. And again, we're using orthobiologics, which are those cell-based injections that are delivered precisely through injection-based routes, and it's a lower risk alternative to more aggressive surgical procedures. So Regenexx itself is an actual physician network that practices interventional orthopedics, and we have our office here in the Pittsburgh area to service the greater Pennsylvania, Ohio, West Virginia, and really all over the place around this region. It's a highly selective physician network, so we have to be specialty trained, very highly trained in what we do and how we do these procedures. We have to train specifically to actually be able to practice these procedures in their specific protocols. And we have the best protocols across the system to give you the best overall results. Regenexx, as a conglomerate, is one of the world leaders in research and development for these types of procedures and orthobiologic treatments. And it's a national self-funded employer practice. So we're all individually funded clinics throughout the country that all do and practice these protocols for various regions and populations. So the conditions that we treat really involve all of the different sorts of pain issues or problems that you would normally refer to an orthopedic specialist for. So anything basically from the top of the head down to the bottom of the toes, we treat almost all of it. So whether it's knees, hips, ankles, spine, shoulder, hand, wrist, elbow, toes, thumbs, whatever it might be, we do most of these treatments, all of these treatments, and we can treat all of these different issues. So this is what a typical procedural setup would look like in our clinic. Over here, we have the ultrasound machine to the far right, and the big C-shaped machine is our X-ray. We call that fluoroscopy, and we use these machines to help with exact placement of these cells and with these injections. This is our ISO class 5 biologic hood, where we do all of our sterile processing for any of the blood products or stem cell products that come from your body. We process all of the cells by hand, and those protocols allow us to get the highest volume of cells and the most concentrated cells for you to get the best treatment possible. And with the procedures, like I said, we're looking at injection-based treatments. So we're looking at needle pokes rather than big scalpel cuts. So In most cases, after we finish these procedures, you're just getting Band-Aids applied to the skin rather than getting big sutures or skin glue or lots of big dressings that require a lot of work and changing. So the result of that is you have less pain after the procedures, less downtime. Your rehab is much shorter, and you're on fewer medications or pain control agents after the procedure, and you're back to work in a few days and not a few weeks or even a few months. Most of these procedures we do while you're awake. We have some different ways that we've provided some sedation and additional anesthetics for comfort. So it's not like we make this uncomfortable for patients by any means. And everybody tolerates these procedures very, very well. So I'll give you some examples of how interventional orthopedics is applied to certain conditions. So this is some views of injecting the ACL, which is one of the main stabilizing ligaments in the knee. We do this under X-ray because it's difficult to see, using the ultrasound technology. But as you can see on the pictures, the contrast flow into the ligament shows that we can place these cells in a very precise area so that we can treat things that would normally take surgery to actually repair in the past. So we're doing these now in the clinic and having great success with it. As you can see in the video here on the right-hand side, this is a needle placement of cells into the labrum of the shoulder. So this is an area that typically would require surgery or require surgical access to complete. We're able to do these procedures and place that needle very specifically into the area where the problem is. And this allows for better recovery without open surgeries, stitches, or prolonged rehab. These are examples of how we are now using cell injections actually into the bone as well as into the joint. So we are now treating both the joint structure itself and also the bone structure, helping things to heal from the outside in and from the inside out. So this allows for better pain relief, better function, better tolerance for activity, and the results are actually showing much longer effects. And this is where we're actually using things like platelets to inject even around nerves. So this concept applies not only to the median nerve, which is the nerve that's affected in carpal tunnel syndrome, but also to nerves, say, in spinal-related pain or other nerve-related processes that give people a lot of problems. We can inject these cells around these nerves and create a lot of pain relief for sustained amounts of time. So how does regenerative medicine actually work? So there's two different types of cells that we'll talk about. The first type of cells are platelets, and this is what you would hear referred to as PRP, or platelet-rich plasma. So platelets are the things in the blood that float around that create clots whenever you injure yourself. Those little platelet factors contain growth factors inside of them, and they also contain other elements that actually help with amplifying healing. So think of the platelets like an espresso shot for local repair cells. So they're busting open and releasing all of the factors that call in stem cells and everything that calls in the immune response. And they're basically the orchestrators of how things start to heal within the body. So the platelets actually help these cells to work harder and to work longer. So they help to stimulate the healing and stimulate cell repair. Stem cells are a little bit of a different type of cell. The stem cells are actually the general contractors for the repair job. So they're actually doing the work that's orchestrated by the platelets or those growth factors. So stem cells just kind of live in the bone marrow, in the bloodstream, and they don't really have a job until you give them a job. So once all those factors come out of the platelets, the stem cells get signaled, and then that's when they go to the site of repair and they start to become and change into the other cells that help with tissue repair and help with damage control. So they also use the espresso shot growth factors, and they become sort of the bricks and mortar that replace the cells or start the process of repairing cells that have been damaged. So which one do we use? Well, it's very patient dependent. It depends a lot on your evaluation, your exam, what kind of problems we're presenting with, what we're treating. I would say in 70% of the cases that we treat, we're typically using platelet-based treatments or PRP. That includes treatments for the spine. And in about 30% of the cases, we're using a mixture of the bone marrow concentrate stem cells and the PRP to kind of boost that process. So both very highly effective. There is a significant cost difference between the two, but not everyone needs stem cells. And like I said, we sort of make that decision based on how you present and what we think that you need. So which one is for you? Now, this is kind of a very basic interpretation of this. This isn't always the exact case, but PRP tends to be used for smaller joints, joints that are less severely affected by arthritis. They're very good for ligament damage or instability. They're also good for tendons, tendinitis, tendon tears, things like that. And they're really, really good for use in the spine. When we usually graduate to stem cell, bone marrow concentrate stem cell treatments, that's when we're treating usually larger joints, joints that usually contain more severe arthritis or damage. What people would consider that quote unquote bone on bone damage. And then also injecting, like I said, into the bone for treatment of the issues from the inside out. So what can you expect from your typical stem cell procedure? So there's three different components that have to go into the stem cell treatments, and it's 3 different days that these treatments are performed. So the first treatment is what we call the pre-injection, and that's basically we use the farming or agriculture analogy. So this is kind of like tilling the soil before you plant the garden. Basically, this procedure is a couple different injections that'll happen into and around the joint that help to stimulate the body's normal immune response to the specific area. So it's almost like priming the pump to help these stem cells sort of migrate to and amplify their response whenever they get there. Like I said, it heightens the immune response, prepares the site to take full advantage of the stem cells once they're introduced into that area. Day 2. This is going to happen a couple days after that initial treatment. This is the first part of that day. There's 2 parts. The first part is going to be the stem cell harvest. Now, this is the part that most people sort of get a little bit shook up about. But what I can tell you is that we do a very good job of anesthetizing the area before we do these procedures. And big red here, I have patients rate the pain, any discomfort from this procedure is very low, usually only about a 3 out of 10 on the pain scale. So the bone marrow, the bone itself is actually the source of the bone marrow concentrate that contains the stem cells. So what we do is, as you can see in this picture here, we take the cells from the backside of the hip area. So we're away from the spine, we're away from the hip joint, so that's not a problem. We anesthetize the whole surface of this area with a whole bunch of numbing medicine. And we use a very small gauge needle to sort of inject into the bone and get these cells out of the bone. This is going to be where most of the discomfort happens for people. But like I said, it's very short. It's very easy to tolerate. Once we're done with it, usually that pain goes away completely. People usually get up off of the table and they say, man, that really wasn't at all as bad as I thought it was going to be. But this is the source of the stem cells. We take that concentrate that we acquire from the area, and we actually process it on site in the lab in the picture that I showed you earlier. And then that's going to be what is re-injected back into that tissue later that day. So the second part of that day is where we take those cells and we concentrate them down and we count them and we know how many we have, and then we inject that back into the joint. So that's planting the seed, again, going back to that agriculture comparison. So we use these injections to inject the cells back into the areas of damage and pain. We're using the cells from that bone marrow aspiration, and we're only using the cells that are coming from you. So we're not using any cells from any other third parties or any other places. Everything comes from you and is injected back into you on that same day. We use, like I said, precise guidance for the cell placement. So whether it's ultrasound or X-ray, we're going to be using both to place these cells back exactly where they need to be. And like I said, that re-injection is going to occur on that same day, a little bit later from that harvest. Now, after that procedure, a couple more days are going to go by. You'll come back, and then this is where we do the third procedure, which is the fertilization process. So we till the soil, plant the garden, and then fertilize the garden. Like I said, this is going to happen about 2 or 3 days after those bone marrow concentrate injections. We do a blood draw that morning or that afternoon from the arm, just like you would give at the PCP's office. We take a bunch of little tubes of blood and we take that for processing in the lab, same one I showed you before. It takes about an hour and a half or 2 hours to process that down, and then we re-inject those platelets back into the joint. Most of the time, it's only one injection, so it's a lot easier. And that's the process of feeding those stem cells and kind of amplifying that regenerative process. So as far as Regenexx history, like how far back do these processes go and what have we done over the course of the years that we've been in practice, Regenexx was the first organization to actually start performing these stem cell-based therapies in the United States. So they've been doing this since 2005 on patients, and they've been keeping registry data since that time. So we've been around in the game for a long time. Regenexx has done the most cell-based treatments. So because they've been around for so long, and the registry data shows that they've treated, over 60,000 patients nationwide, which is a huge number for these types of injections. They've proven their safety profile. There's a paper that we'll talk about here in a little bit that shows from that data that they've collected over these number of years that these procedures are safe. And it's the most researched. So Regenexx actually holds a lot of the research worldwide for these procedures and for how these cells are processed, harvested, and utilized in these procedures. So like I said, Regenexx has the largest database of patients, and they've used that patient data to publish the world's largest safety paper on these types of procedures. And the results add to the existing body of evidence showing the safety of these cell-based procedures for orthopedic conditions. So basically, the biggest outcome that they saw that most patients complained of was just discomfort at the injection sites. That was the biggest risk that they saw with these. No risk of infections, no risk of more adverse things like nerve damage and stroke and death. All the things that we talked about before are infinitesimally small in comparison to what you would see with surgery. So like I said, that research, the registry now contains, well over that number of 34,000 patients being followed. Those patients have been followed since time zero. So before we've even started these procedures, these patients have been in the registry and we monitor their responses over time. So this isn't data that's been cherry picked to just reflect the best outcomes. This is all the outcomes that have been measured from patients that have entered the process. From this registry and from the other research that's done through the corporate office, we've actually been able to publish about 29, it's probably even more at this point, peer-reviewed papers that show safety. They show how these cells respond, what the best way to use them is. And that helps us to know what the next steps are in terms of the best way to treat you, the best way to perform these injections. And it's just been feeding back into itself and helping us to make these treatments the best possible treatments that they can for everyone. There's some ongoing research that's going on now, ongoing clinical trials that they're doing for different types of outcomes. And we're seeing more and more what's possible with these types of procedures. And like I said, we're using this type of data to stack the deck in your favor. We found that you need to have highly specialized doctors. You need to use very exacting images to apply these procedures. The research that they've done and the safety outcomes that have been gathered from that definitely help with patient knowledge and what we need to do more. We've been able to personalize this type of procedure, so everybody gets treatments that are based on your individual needs. So we've been able to customize these treatments for what people need and how they need to be treated. And then evaluation and candidacy is a huge factor because we want to be able to let you know very specifically, can we help you? And how well do we think that it's going to affect you? And how well do we think how good of a result do we think we're going to get? And we use a lot of that transparency to be very upfront about finances and outcomes and everything that you guys have lots of questions about. So who's it for? It's for people that want to avoid surgery. It's for people that want to keep all their parts and don't want to be cut on and don't want to have things replaced with metal. It's for people that don't want lengthy downtime and prolonged rehab. You don't want to be off of work. You don't want to be losing that money when you can't stand and can't move and that time with family and that time with friends. You don't want drugs. You don't want medications. You don't want to be on prolonged narcotic medications or anything like that. Maybe people that have had failed surgery before. We do get a lot of patients that have had one knee replaced and don't want to go through it with the second one. And we talk about what the options are. Or maybe I've had individuals that are too young for surgery. I see some people in their 40s that have, bad arthritis or issues that they don't want surgery for. And I've definitely been able to treat those people and get very good outcomes. So what are the results? So like I said, the best practices and the best protocols are definitely going to yield the best outcomes. And that's really what we try to do. The network has given us the tools to be able to put these best practices in place. And that definitely reflects in how people feel after these procedures. And again, less pain. We're using very minimally invasive processes to do this. So, not only does it reduce the pain that you have at baseline, but you also don't have a lot of pain from the procedure itself. Looking at increased function, you're able to move better, able to stand better, walk better, do your activities throughout the day better. That improves your mood. That gets you off of pain medication, which people don't want to be on anyway. And it gets you back to your preferred and active lifestyle. So major reasons to kind of take your health off hold today. A lot of people avoid surgery and they kind of backlog their issue as they continue to get worse. I don't want to have surgery. I'm just going to push this off. I'm going to deal with the pain. I'm going to, wait until it gets so bad that I can't walk. And you don't have to. You don't have to let it go that long. And some surgeons will tell you, well, I'm not going to do surgery until you can't walk. Well, why would you wait until your body deteriorates that far to be able to do something? You have the option to kind of stay ahead of it and do something about it now. Get your fitness back, get your weight back under control if that's an issue. The longer that kind of stays a problem, the worse health outcomes there are, down the road. So we want to try to get that in check. Increase your quality time with your loved ones. You don't want to be sitting on the sidelines while everybody else is having fun. So get back out there, start moving better, start doing the things that you enjoy. And no one's getting any younger. The age wheel keeps on turning. And, despite what we may or may not want, that's just a fact of life. So we want to try to stay ahead of things if we can. Certainly being older doesn't preclude you from having treatments at all. But we want to try to stay ahead of these things if we can. So financial information, insurance does cover consultations with us. Anytime you come into the office and you talk with us face to face, that's based on your insurance. Any follow-up that you have with us, any diagnostics that you might need that you don't already have, whether it's lab work or imaging or whatever that might be, bracing if we need it after the procedure, and additional physical therapy or whatever that looks like, all of those things all covered by your insurance. The things that insurance does not cover are the regenerative procedures, anything that we do with platelets, anything that we do with stem cells, any type of treatments that we do that way. Insurance does not cover those types of things. But these treatment plans, like I said, are all very customized. There's a very wide price range with a lot of this. So really the only way to give you a better idea of that is for you to come in, see what we need to treat, how we need to do it, and talk about that. The biggest takeaway before this becomes something that overwhelms you is a lot of times with commercial insurances, when you look at your co-pays for surgery, you look at your co-pays for therapy, you look at your deductibles out of pocket, you may actually be paying more out of pocket for surgery and for that prolonged rehab than you are with actually just going through one of these treatments and truncating a lot of that and maybe saving a lot of time and money in the process. So what are the next steps? Well, you don't need a referral to come and see me. Most networks do not need a referral. So you can call, you can make an appointment, go ahead and gather any imaging, whether it's MRIs or x-rays. If you don't have any of that, don't worry about it. If we need it, we can order it. So you don't have to run out to your PCP and have them write you up a bunch of stuff. Just come in and talk to us. Call our office. You'll talk to our Regenexx liaison, who's going to help to make an appointment, whether that's in person or over telemedicine. And if you don't have imaging, we can get it. Like I said, we can figure out if you're a candidate, and we can get treatment if needed. We can get you doing some rehab, and then we can get you back to the life that you want to be a part of. So next steps for you, best thing to do is take down the number here, 412-963-6480. You'll talk to Sarah Furlan, who's one of our national Regenexx liaisons, and we'll get you set up with an in-house consultation so that you can talk to us and see what we need to do for you. So what I'll do now is I'll open up the floor to questions. You guys can ask anything and everything about the procedures, and I can do my best to try to answer general questions the best way that I possibly can. So let me take a look here and see what we got. So Joseph asks, why isn't the price coming down? It has gone up since I was there in 2017. Lowering the price would open it up to more people. The price, we have been sort of, keeping with what we need to do for processing and what we need to do for these treatments. Like I said, the value of these treatments sort of speaks for itself. It gives people back the function that they need and the lifestyle that they kind of want. So we do our best to try to give that to people for what it is. And, there's a lot of additional work that goes into these procedures. So it's not an easy thing to do. And that's why we're trying to keep it the way it is. Any questions, I guess, about the procedure itself? Any questions about, okay. If both knees are bone on bone, can you treat both at the same time? That's an excellent question. We get this a lot. In a lot of cases, we can't, but the reason for that is that when you extract these cells, when we're doing these types of things, it's very difficult to know how much cell product we're going to get when we do these treatments. So in a lot of cases, we'll focus the treatment on the joint that maybe has more severe arthritis first, and there's some additional treatments that we can do to the other joint at the same time. But, there's a little bit of downtime where, I don't want to create problems where it's difficult for you to get around and difficult to move. Plus, we've just found that treating one single large joint at a time gives people better outcomes for longer term. Shelley asks, does it matter how long ago your injury occurred as to the success of the procedure? Short answer to that is no. I mean, we have patients that come in and have had pain and issues for years. If there's certain acute injuries sometimes respond better early, but in most cases, I'd say the large majority of cases, it does not matter when your injury occurred. So we can treat that really at any time. Anonymous says, I've also heard about umbilical cord stem cells. Is that something you offer? No, it is not. And is that, and what is your opinion of cord cells? I don't think that it is a good treatment. There have been plenty of studies done by very large academic institutions, Brown, Cornell, Emory, lots of these other places that have actually shown that the umbilical cord stem cell solutions off the shelf, actually, when you try to grow them in a lab setting, do not actually produce any what they call cell colony forming units, which basically means that they don't grow any cells on petri dishes, where if you take cells directly out of the bone marrow and you do the same thing, they will actually grow very abundant colony forming units, which means that they grow large amounts of stem cells. So umbilical cord stem cell mixtures, I don't think are a good treatment. I don't think that it's very ethical. I don't think that it's something that should be offered, and we don't offer it. Joan asks, if hand joint is bone on bone, do you need stem cells or PRP? In most cases, When I'm treating small joints like the hand, we usually use more PRP platelet-based treatments. I found that smaller joints tend to respond well or equally as well with the platelet-based treatments as it does with the stem cells. So that's typically where we guide that treatment. Anonymous asks, can PRP and stem cells encourage cancer since they are growth agents? The short answer to that is no. We've never had an issue with cancer ever in the network or with any of these cell-based treatments. So no, they are not cancer-forming cells. Can you get a regenerative treatment after a knee replacement? In terms of treatment, yes, there are things that we can treat after a knee replacement. Actually, treating the joint is probably not going to be performed, but if you already have a fake knee in there anyway, chances are that it's not the joint that's creating pain. It's usually issues in terms of tendons and ligaments and things around the joint that are causing more problems. I've seen that in a number of different cases where people come in after knee replacements and want the other knee treated, but we end up doing some additional treatment on the prior surgery knee because there are issues that we can treat there. Ryan asks, you're going to do a stem cell procedure and you run into a bone problem. Do you rebuild the bone first before you inject? This is a very detailed question. So the treatment, Ryan's asking a very detailed question about rebuilding bone. The truth is that if you have bone issues related to arthritis or you have bone issues related to some other process happening in the body, we're going to be treating the bone at the same time we're going to be treating the joint. So we treat bone problems, bone related pain, by actually placing the stem cells into the bone. And this was based on research that actually came out of France about 2 years ago, from a 12-year study that they did there, where they looked at injecting cells into the bone at a high volume and how that translated into pain relief. And right now they're showing, over 80% improvement for that sustained period of time by doing the procedure that way. So that is kind of the quote unquote standard of care that we've sort of adopted. Just understanding that, I think, is the better way to answer your question, Ryan. And we can talk about that a little bit more in detail if you came in and talked to us. But that's kind of a difficult question to answer here. Any other questions? Ryan asks, if you had a Labrador repair, Labrador, I don't know if you're referring to labrum, and a capsule shrunk around the hip will stem cell. So again, these are very detailed questions. It depends a lot on what your exam looks like. It depends a lot on, we can ask very specific questions about these different types of treatments, but unless I can see you in the clinic and actually see what's going on and reference imaging and things like that, I'm not going to be able to give you exact answers on very specific questions about different joints and different issues. And that's not because I don't know or because there is no good answer. It's just that it depends a lot on examination. It depends a lot on the patient's body and how we think they'll respond to these different types of things. Next question. Have you treated posterior tibial tendon tears in the ankle? Absolutely. And they respond very, very well to these types of treatments. There's a lady that I actually just treated from Georgia, who's a aggressive pickleball player who responded significantly well to this and is super happy with her outcomes. Ryan, no problem. I appreciate the questions. Anybody else? These are really good questions, guys. I appreciate you asking this stuff. It's good to kind of talk with you guys, because I know there's a lot of burning things related to these procedures that people want to know. How long do the stem cell procedures last? That's a good question. So The best reference that I can give you is to go onto our website and actually look at the registry data, because there's different results depending on, you know, where you're having problems, where you're having issues, and the database, the registry, is actually designed for this specific issue, to look at different areas of the body and what you can expect in terms of outcomes and for surgery, or for avoiding surgery, and all these other sorts of questions. So I guess the answer to that question is that it depends. But like I said, if we're looking at knee related treatments, specifically, there's that data that just came out that shows, you know, even up to over 10 years, people are having very good outcomes. How long is the average recovery time for a tendon tear in the ankle? Do you need to get a walker and stay off the ankle? Again, very specific questions, but the average recovery time for any tendon issue is not long. You don't need to have, you know, a lot of walker, or you know, you don't need to be holed up with weight bearing restrictions or anything like that. You know, I may, depending on the severity, I may brace people for a little while, but you're back into physical therapy about a week after the treatment, and you're not needing to avoid weight bearing or anything like that after the procedure. But again, that's sort of patient to patient dependent, so worth talking about. Short answer to that question: are we looking at tens of thousands? No. Why, again, I appreciate these questions, guys. If you have any more, keep them coming. And I'll be happy to answer however I can. You know, but like I said, best way to get all of your questions answered, best way to get the absolute best information is to make an appointment with us. It's hard for me to answer a lot of very specific questions unless I'm looking at you and looking at your imaging and looking at your exam, and actually kind of putting together a treatment plan that sort of fits you. I'm happy to talk about recovery time. I'm happy to talk about physical therapy. You know, all of these different things are what we can do in the clinic, and looking at it with imaging in the clinic, even with ultrasound, definitely helps me to give you guys a better idea of what you need and how aggressive it's going to be. You know, typically looking at like platelet based treatments, I know cost is a big question for everybody. Typical platelet treatments tend to start around $1,600. And that's what it would be for more tendons and that sort of thing, or more mild to moderate arthritis. And then your typical stem cell based treatments usually start somewhere around 8,000. So is it tens of thousands? No, not even close. And again, you know, is it worth it in terms of what you're getting for what you're actually putting in? Yes, 100%. And actually, right now, with the stem cell based treatments, we're actually, you know, giving people a little bit of a money off offer if you schedule within 30 days. So you know, there is benefit to getting in there and getting things accomplished, and we're happy to help you guys however we can. How long do you have to stay off your hip after a stem cell procedure? The short answer to that is it depends on how aggressive we're being with the treatment. Sometimes if we have to go into the bone in a hip, we tend to do about 1 week of non-weight bearing after that procedure, just because the hip is a much more sensitive area for that type of a thing. But in most cases, for knees or other joints in the body, you only have about 2 days of time that you have to limit the weight bearing on the joint. So the hip is definitely the longer one for the bone related treatment. If it's not a bone related treatment, then there's only that 2 days of downtime after the hip injections, and then you're back to full weight bearing immediately after that. Where in Pittsburgh are you located? Our main office is in Fox Chapel in RIDC Park. I also have 2 satellite locations at in Bridgeville and in Washington, PA, in the South Hills. But the 2 main areas that we tend to see new consults are the Fox Chapel office and the Bridgeville office. So we have some areas in the north and some areas in the south that you have easy access to. Again, what's the average PRP cost, Miss? What you said. Average PRP tends to start at about $1,600. Good questions, guys. I'm definitely getting some good stuff from you guys here. And if you like the feedback, keep firing them at me. But like I said, make an appointment in the clinic. I'm happy to look at specific imaging for you guys and put together a plan for what you need. Based on the questions that you're asking me, I do think that a lot of you guys would have good results with what we do. Physical therapy. How long is physical therapy after stem cells? Like I said, it's patient dependent, but typically we're usually seeing, anywhere from, I usually start people at about 4 to 6 weeks. It definitely depends on patient's function. So like if you're pretty functional and pretty healthy, otherwise, it may not take that long. If you need a little bit more work, it may take a little bit longer. But I guess what I can say is the average physical therapy after these treatments tends to be about 1/6 of what you would actually spend in physical therapy for more aggressive surgery or more aggressive replacement surgeries and things like that. So it does depend. So that's kind of a hard thing to say that it's going to be specifically this long. How does the cost of stem cell compare with knee replacement given high deductibles? That's a very variable question. It depends on your deductible. It depends on your surgeon. It depends on your insurance plan. So there's really no way for me to address that directly. But if you do have a high deductible plan, I would say your costs are probably going to be close or equivalent or more. I guess it really just does depend on what that looks like for your insurance. Discount for 30-day period. It's right now. It just depends on. I would say just call in and talk to the liaison. That way you'll know. But I think it's typically around 500 if you schedule within that 30-day window. Does PRP help the pain, or does only stem cell help the pain for arthritic bone on bone? It definitely depends. Again, very specific questions for very specific issues. It's much easier for me to answer that question if you're in the clinic. I can see how, like, what the area looks like and what we're trying to treat. It's much better for me to be able to talk you through that once I know more about the actual issue. If physical therapy is needed after treatment, is it done in one of your offices? No, we don't have physical therapy actually in the office. We refer all of our physical therapy out, and that's to your choice. So, if you're from somewhere that's not close to Pittsburgh, you definitely have the option to do therapy close to home. And if you have somebody that you know and trust that you want to work with, we definitely recommend that. I do have recommendations for certain physical therapy places, depending on where you are and what you need. So we tend to farm that out to wherever patients are most comfortable. Do you see the stem cells regenerate cartilage? If you have cartilage that's deteriorated, no. The short answer to that is no. That's not really how these treatments work. So if you're expecting me to regrow you a 25-year-old hip or a 25-year-old knee, that's not really how these treatments operate. So if there is cartilage that's there and present within the joint, then yes, in certain instances, you can see cartilage bolstering and you can see cartilage improvements. But in terms of actual regrowth of large areas of cartilage lost, that's not really what like how these treatments are designed. PT is PT covered by insurance? Yes, PT is usually covered by insurance. Again, outside of your typical copays and deductibles and things like that. So that's going to be dependent on your insurance plan. Good questions, guys. I'm trying to be as thorough as I possibly can with these answers, depending on what the issues are and what we're dealing with. So I'm hoping that it's helpful for you guys. Again, best way for me to sort of give you the real answers in terms of how effective we can be and what we're actually going to do, how we're actually going to do these treatments. Best to get you in the clinic and really just examine you, see what the problem is, see where the deficits are, see what we need to treat. And that gives us a whole new open window with how we approach this and what we can actually do in terms of talking you through these issues. So, if you want to come and see us, the number again for the clinic, 412-963-6480. You'll talk to Sarah. She's great. She can point you in the right direction. She'll give you a lot of information, and you can definitely get in at your earliest convenience and come and see us, and we can answer all the questions. So I'm gonna wrap it up for tonight. I really appreciate you guys and all the questions that you've given to me. Don't forget that you can go on to the website at regenexpittsburgh.com. That's 2 X's, REGENEXX, Pittsburgh.com. And you can actually fill out a candidacy form on the website as well as calling. So if you'd rather just do it on the web, feel free to do that. And then that way you have direct access into the system. Take some time to do that, and you'll get contacted by Sarah, and you guys can come and see us, and we'll get all your concerns and questions answered, and hopefully get you on your way to good recovery. Thanks you guys for coming out tonight. Really appreciate it. Really appreciate the questions and appreciate your time. Hope to hear from most of you guys soon. Have a great night, and thanks for joining me.